Today I'm here with Dr. Phil Bomeli. So we're going to talk about the different options there are right now.
Of course, you still have the typical braces, the either metal or ceramic that you might see on a patient, but some things that are out there now that are much more customizable. Focusing on the intricacies of your particular child's teeth and or your teeth, depending on who's the patient at hand here. But we have, as I'm sure lots of folks have heard about, clear tray aligners. Invisalign is what most folks know them as, and those are just a neat way to move your teeth. They're very aesthetic. It's hard to see them, and they don't have a lot of the disadvantages, if you will, with regard to any sort of braces at all. So there's no pokey wires, there's no emergencies per se, things of that nature. So that can be appealing for a lot of folks. And one other thing that's coming out now too is customized braces for patients. And the main advantages there is that they are custom specifically. The braces are made specifically for you or for your child. And so that has a major advantage, because then we've seen it cut down on treatment times. So the overall time in treatment is decreased. And with that as well, we find there's the less need for more appointments. So I guess less appointments are needed in shorter periods of time overall with regard to treatment. So that's advantageous, because folks are so busy these days with soccer and band and all the kinds of stuff. So less appointments can certainly be appealing.
Where does the conversation start when you're sitting with a middle school kid and their parent about which of the options are the best one for that child?
Sure. So with these situations, we have so many things to consider. One of them is, how soon do you want to get started with treatment? How is your child best served with something that's removable, that they can take in and put in and take out on their own? Is that a good idea for them? Are there hygiene concerns? Those kind of considerations, because if parents know their child better than I would know them. And so, if we feel that Invisalign is an option for them from a standpoint of their bite correction necessary, those kind of things, well, when it comes to, the patient's maturity level, they may or may not be ready to do that. So that needs to go into consideration. Whereas, braces, well, they're on the teeth, they're glued on there by us, and we obviously glue them on there the best we can. Do things come off from time to time? Sure. But there's less compliance issues with regard to that. There still are compliance issues, though, when it comes to wearing rubber bands and things of that nature. So through, at no point, there's no option at all that is completely devoid of any sort of treatment compliance. I mean, with braces, your compliance is more on hygiene and those kind of things, and then rubber bands, of course. But as far as the Invisalign trays are concerned, the trays don't work if they're sitting in your pocket, or they're on the bathroom sink area, things like that. And so that can be frustrating if that's not happening.
Dr. Phil Bomeli, thanks so much for being here with us.